This is an excerpt from our Live Well magazine Summer 2024-25 edition.
Signs of a Stroke by Sam Barford. Every second counts when spotting the signs of stroke. Stroke can happen to anyone at any age. Spotting the signs and symptoms is crucial to seeking fast medical assistance and increasing the odds of a good recovery. Rapid response is crucial to minimizing the long-term effects of a stroke. Stroke occurs when there is a lack of blood flow to parts of the brain due to a blocked or burst artery. This causes damage to the brain tissue, which can have a severe impact on mobility, speech, vision, swallowing function, and behavior. Support worker Frances experienced this firsthand during one of her regular visits to a client in regional Tasmania. Upon arrival, Frances noticed her client, Audrey, wasn't herself and was slurring her speech. Frances drove Audrey straight to the hospital, where the medical team determined the 90-year-old had suffered a stroke. Fortunately, Audrey made a full recovery with no lasting physical or cognitive damage. The doctors said this timely intervention resulted in a good outcome for Audrey, Frances said. Her family was very grateful. What to look out for? Signs of a stroke can vary, but the symptoms often come on quickly. They can include slurred speech or difficulty understanding speech, trouble seeing out of one or both eyes, including blurred or double vision, dizziness, loss of balance or lack of coordination, numbness, tingling or weakness, particularly on one side of the body, face, arm or leg. Sudden severe headache, which is often described as the worst headache of one's life with no known cause. Difficulty swallowing. Act fast. To determine if someone has had a stroke, you can look for specific signs and symptoms. The FAST test is a quick and effective way to assess whether someone may be experiencing a stroke. FAST test. F. Face. Ask the person to smile. Does one side of the face droop? A. Arms. Ask the person to raise both arms. Does one arm drift downward? S. Speech. Ask the person to repeat a simple sentence. Is their speech slurred or strange? T. Time. If you observe any of these signs, it's time to call emergency services immediately. Time is critical in stroke treatment. Actions to take. Call emergency services on 000 immediately. If you suspect someone is having a stroke, seek medical help right away. Note the time. Knowing when the symptoms first started can help healthcare providers decide the best course of treatment. Sam Barford is a registered nurse and senior manager of health services, recently celebrating her 10-year milestone with integrated living.